Hello, thank you for visiting Children's Emergency at KK Women's and Children's Hospital. Your child has been diagnosed with constipation. We have put together this video to help you better understand this condition, how to care for your child during recovery, and when to return to see a doctor again if required. Constipation refers to infrequent bowel movements and the passage of hard stools associated with straining and pain on defecation. It is a common problem in childhood and is rarely the result of an underlying medical condition. In young children, constipation often follows toilet training, changes in routines such as starting school or travel, inadequate dietary fiber and fluid intake, periods of inactivity or sedentary lifestyles. When it is time to pass motion, children may ignore the urge and withhold stools for several reasons. 1. Stressed about potty training. 2. Embarrassed to use a public bathroom. 3. Distracted by playtime or fearful of having painful bowel movement. This creates a vicious cycle whereby accumulated stools become larger and harder, resulting in more pain and more withholding. Chronic constipation leads to stretching of the rectum, and over time, the normal urge to pass motion is reduced. Symptoms of constipation include hard and dry stools, fewer bowel movements than usual, pain over anal region, especially during defecation, crampy abdominal pain, fresh blood stains on diaper or on wiping of buttocks, overflow diarrhea, as liquid stools from higher up in the colon may bypass the obstructed hard stools and result in soiling or incontinence. If your child fears that having a bowel movement will hurt, he may try to avoid it. You may notice your child crossing his legs, clenching his buttocks, rocking back and forth on his toes and heels, or making faces when attempting to hold stools. The mainstay of treatment for constipation is ensuring a balanced diet with adequate fluid and fiber intake and proper bowel habits. Medications may be helpful in cases of severe constipation to achieve regular bowel output. Encourage your child to eat high-fiber food and drink adequate amounts of fluids. This enables stools to become soft and easy to pass out. Foods which are high in fiber include fruits, vegetables, whole grains, beans, nuts, and seeds. Getting children to increase their fiber intake may be challenging as many children are fussy eaters and dislike eating fruits and vegetables. Here are some tips to get you started. Offer fruits with every meal, cut up into little chunks or cooked with yogurt or chocolate sauce. Introduce brightly coloured vegetables that are sweeter in taste and less fibrous, such as carrots, corns, and peas, as compared to leafy vegetables. Additionally, children can be given small amounts of fruit juice with no additional sugar. Certain juices that contain fructose have a laxative effect, such as prunes, pears, or apple juice. Encourage your child to sit on the toilet bowl on a regular basis. Aim for 5 to 10 minutes each time, twice a day. Allow plenty of time so that the stools empty completely. Do not allow your child to bring in mobile phones, gaming gadgets, or books which lead to distraction. Use a stool for support if your child's feet are unable to reach the floor while sitting on the toilet bowl. This allows him to use strength to step on the hard surface and push out stools. A reward system is sometimes useful in younger children to reinforce good bowel habits. Consider stickers or star charts. Praise your child for passing a stool in the potty. You may get frustrated when your child refuses to pass stools or have soiled pants. Keep calm and encourage your child instead. Consult a doctor on the use of medications for constipation. In general, there are two types of medications. 1. Fluid enema administered via the rectal route. 2. Oral laxatives in the forms of syrup, sachets, and tablets. Common examples that you may have encountered are lactulose and forlex. Laxatives often need to be continued for several weeks as maintenance therapy, and the doses gradually wean down rather than stop abruptly. You should seek medical attention if your child develops severe abdominal pain, especially if not resolved with defecation, abdominal distension or swelling, persistent vomiting, greenish vomitus, poor oral intake, large amounts of blood in stools, leg weakness or numbness with unsteady walking. In summary, constipation is a common problem in childhood, and the mainstay of treatment is through lifestyle modifications.